One thing that I'm concerned about is we need nurses and doctors. It takes about 4 years to train a nurse and almost a decade a doctor. And then additional years of training needed for specialty area. So unless you expand the number of nurses and doctors to care for the influx of the thousands and thousands of uninsured, our resources will be stretched. So the number of doctors has increased only about 1% a year for about the past 5 years. And for nurses, the number has stayed at 1.4 million for the past 4 years, but yet our population increases by 3% a year. So we're not even keeping pace. So with the cost controls that this administration is proposing, this translates into income control for nurses and doctors, which will lead to fewer people coming into the profession and will contribute to the nursing and physician shortage as well. And we'll see further stretching of healthcare services to cover a larger number of people and ultimately to rationing of services. So we'll see the rationing of services, which in turn will decrease the quality of care that you receive in the hospital. And all you need to do is just look at Canada and Great Britain, where there's so much bureaucracy there, and those decisions are made for the people. And the decisions are based on age and cost. And of course, their care is prioritized and rationed. So the elderly, they're put aside. The disabled, mentally challenged, those are the people that we really have to be responsible for and look after. Because in this administration, they'll be considered second-class citizens. So, and also in these other countries, the waits are just so long. Sometimes they're waiting months, and the condition worsens, or the patient may even die before their turn comes. But I'm so amazed that the number of the congresspersons, louder? Okay, is this better? Okay. I don't want to have to start all over, so I'll just do what? I'm not a singer though. Thank you. I am amazed at the number of the Congress who are so quick to claim that a government-run healthcare plan is what this country needs, but they exempt themselves from this option. They exempt themselves from this option. So instead, they will keep their existing health plan and services. So if members of Congress believe so strongly about this government health care plan and that this is the best solution for working Americans, then they should lead by example and be accountable for what they are advocating. And I challenge all Americans to demand this from their representatives. After all, they are our public servants, so instead, they know that there are better options, but they want to keep it for themselves. So, we really want Washington to slow things down, but as you see, that is not going to happen. I mean, what do they say about the emergency? They're going to use each emergency, each crisis as an option to continue to push things through. But it's really up to us to be vigilant. So you really have to be vigilant, just be aware of what's going on, be in contact with people just like yourselves, and just join different groups and organizations. Just write your congressmen, the senators, just write them and tell them that you do not want this health care plan, this health care bill. In our health care, and one thing is with this health care plan, there should be doctors and nurses who are actually at the patient's bedside who engage in this health care debate, but actually we're left out. So it's basically being run by the bureaucrats. You're right. So unfortunately, that's what's going on now. And also, we're concerned about the abortion. It is in there, regardless of what they're telling you. And abortion is not health care. I mean, it is not health care. And also the conscience clause, I mean, that is being eliminated also. That, I mean, there's certain, I have standards, there's things I will not do. So, and there's thousands and thousands of other healthcare providers and professions who will stand by their beliefs and just stand up for what is right. But just continue to get involved. I just want to thank you all for coming. There's so much more information that's out there. I'm going to turn it over to Dr. Bob Onder, and he will fill you in on some more information, some more of the details. But just keep in mind that there is a nursing shortage, doctor shortage, and it will get worse, unfortunately, if this bill is passed. So thank you all for your time. Thank you, Patriots!
All right.